Swaddling babies is an ancient practice still used in hospitals worldwide, but modern science reveals surprising new facts every parent should know. Research shows swaddling helps 80% of newborns sleep longer by preventing startle reflexes. However, improper techniques can increase hip dysplasia risk by 30%. Here are 3 evidence-based swaddling rules for 2025. Rule 1. Always leave room for hip movement. The International Hip Dysplasia Institute warns tight leg wrapping harms joint development. Use sleep sacks with hip-healthy designs instead. Rule to stop swaddling at 2 months or for signs of rolling. Overheating and restricted movement become dangerous as babies grow. Rule 3. Never place swaddled babies on their stomachs. This doubles SIDS risk according to American Academy of Pediatrics studies. Traditional blanket swaddling causes 40% of overheating cases. Modern alternatives like zip-up swaddles reduce this risk while keeping benefits. Signs you're swaddling wrong. Baby fights, the wrap skin appears red or sweaty. Hips can't move freely. For babies who hate being swaddled, try transitional products. Like Merlin suits, they provide comfort without full restriction. Remember, every baby is different. Observe your child's signals and consult your pediatrician about what's best. Subscribe for more science-backed parenting tips. This channel turns medical research into practical baby care advice.